Coming up in today's video, guys, see how we get this ear canal from looking like this to looking like this lovely squeaky clean eardrum there. My name is Reece, I'm one of the audiologists here at Audiology Associates. Thanks for watching our Earwax Removal compilation video today, guys. 3 patients in this compilation. So you can see here we're starting off with a very, very thick type of plug here. It's almost a lot of dead skin in the middle of this one. The skin's come away from the canal wall. It's just bunched around that wax, and it can cause real kind of issues in here when you try to take this away, because the skin is still attached somewhere along the canal wall, and then the wax is attached to the skin. So it just causes a few issues there. But coming away really nicely, standard size ulnar tube in here. So lifting from the base of the canal, trying to bunch all of this skin into the actual suction tube itself, just to get a better grip, to hold onto it a little bit more tightly. Yeah, you can see how it started to pull forwards here. So Taylor just repositioning. There we go. Let's see if we can get this in there. So this is one of Taylor's patients. Now, I haven't seen this one. The patient, I can't remember the order they run in, but I think the next on the middle one, I think, is a really, really good one. So make sure you keep an eye out for the middle one, which was my patient, which was a very, very dry type of wax, very impacted as well. It's a good one to watch. So we're just pulling this, this section down. There we go. Taylor's actually got a good grip on the skin here. So he's pulling the skin and it's drawing the wax with it. So nearly there. Let's give this a little bit more of a wiggle. It's on its way. It's starting to pull forwards. There we go. And again, pulling forwards. Yeah, it's just, he's almost got it. Now it's starting to work its way down. And just pulling this last bit. So the skin's gone now. This is just purely the wax that's coming away at this point. There we are. Lovely wax plug. Eardrum looking good. There's a little bit of skin, I think, to the left-hand side at the entrance there. Yeah, there you go. So Taylor's just going to remove this section. There we are. It looks more like a bit of soft wax. Difficult. The first little bit he took away was skin, but I think the rest of that was soft wax. A little tiny bit of thin keratin there at the base. Just getting away the crumbly bits. There we go. And looking nice and healthy. Other ear canal, very, very similar story. It looks like one big plug. So I think, you know, if you can get a grip on the front section, if it is just a plug of wax, this whole thing may well come out, because there was that lovely gap that was traveling all the way down. So if you lift it from the base, it'll come away. No, this is, again, a mixture of skin and wax by the looks of it. So this isn't going to come away as one plug. This is going to come away as lots of tiny pieces. Looking for the next area to work on. I would probably do the same, lift from the bottom here. When you can see this particular type of ear canal where the wax is just adhered to the canal wall all the way around, it's really, really difficult then to navigate that canal, because what you have is this thick wax that you just can't work out the sort of orientation of the canal. And we use that to work out depth in the canal. You know, everyone has these bends in there, so it's really important that you can see where those bends are coming, because you don't want to bump the suction tube against the canal wall, because what would happen at that point, it would be really, really uncomfortable for the patient. So I'm just going to lift. There we go. Let's lift from the sides. Just pulling forwards. There we go. It's a little bit of a wiggle here, because I think this plug here, I think, is attached to a little bit of skin beyond. Oh, there you go. So now you can see it. There you go. There's the attachment. So now he's got hold of the skin that was just underneath that plug. And now we're going to start drawing this forwards. I think he's switched to the fine end here now. Probably just because that entrance is a little bit sort of folded over. So he's just trying to get the best grip in there. Lots of wiggling. Nice size plug, that one though. That's a good plug. And what have we got here? So we've got a little bit of soft wax at the entrance to the canal, and then we've got this soft wax at the top there as well. A little bit of skin here at the bottom, so let's get rid of that skin first. There we go. And a little bit of soft wax here, and then we just got that bit to the top left then to work on. Guys, if you are enjoying the videos, don't forget you can always smash that like button for me. That would be absolutely fab. That way then everyone else knows this is a good video to watch. So if you don't mind doing that, that would be absolutely brilliant. There we go. We're almost there. It's coming towards this bottom end. Just lifting off. Is it going to peel? Oh, it's going further in. Is it going to peel away? I think it might. There you go. Off that comes. Eardrum looking fab though. Lovely shiny eardrum beyond there. Good light reflex there as well. And there we go. So we've got just over 2.5 centimeters, 1 inch worth of wax. So coming up next, guys, a really super compacted type of earwax. And it was dry as a bone as well. Really, really dry. Look at that. It's just all flaky. You can see it just looks solid. It just looks absolutely rock solid. So this is actually my patient here. Classic cotton bud use, this one. Now the patient did explain to me why. I said, oh, you really shouldn't use cotton buds. He was going, no, but my ears get so itchy. That I use it to sort of give it a good old scratch in there. And I kind of understand where they're coming from. So there's nothing worse than an itchy ear. You really want to get in there. But if that happens to you, the best thing you can do if you get an itchy ear is put your finger on the outside edge, push the tragus, which is this floppy bit here, shut, and wiggle it up and down like that, okay? And what that does, it gives you a really deep scratch without you actually putting anything in. Now, my advice to this patient, post-procedure, 2 seconds, sorry guys, but look how thick that silvery skin is underneath there. That is a solid, thick layer of dead skin. Now this is why it's been itching this patient like mad. And I'm trying to lift from the side here, but I can see I'm really struggling to get this to pull forwards. I'm really hoping it's going to pull forwards. Lost my train of thought. Yes, my advice to the patient post-procedure for this one is definitely use some olive oil on a regular basis. Moisturize that skin. It's going to help with that, to take some of the itchiness. And if you're getting really bad itchiness to your skin, use a little spray called Ear Calm. You can get it over the counter in the pharmacies, and you just use that for a couple of days. It's an acetic acid spray, so it just basically returns the pH of the ear canal back to normal. And then what that's going to do is it's going to take away a lot of that itching sensation as well. So it's coming away really well. There we go. I did see somebody put a comment the other day where I recommend oil, using sort of medical grade olive oil a lot. Some patients have difficulty getting hold of it in the US, because we have quite a large US audience. I think there is one called Clear, which is CL-EAR. I think you can get that in the US. I'm almost positive you can. So that is an olive oil spray. The only downside of that spray, I would say, which I found out recently, is that it only lasts for 28 days. Okay, so it's a bit like when you had the drops, you could open that up and you could then, they have to throw them out after 28 days. I read they've changed the package. I'm sure they have, because I read on the box that you have to throw it out now after 28 days. There are others out there which do last longer, but I don't think they're available in the US. So I've broken that top section away. Now we've got the same, I know this is not the same, but this is the right hook, sorry, in here. Bold choice for me, this one is, do I think this is tough enough that it's going to pull everything? Oh, it did. It pulled that front section as well. Look how thick that layer of skin is under there. That long sort of strip, that V shape there at the front. My goodness me, I didn't think that was going to come away as cleanly as it did. There's a couple of little bits, a dry piece there to the top left, and a few bits of dry skin as well. So I'm going to try and get rid of some of these bits of dry skin, just because the patient did mention their ear canal was quite itchy. So we're going to try and peel some of this away, just so that when they do start using the oil, it's working on the fresher skin underneath. There's a little sort of, almost like a little roll of dry skin there to the right, but I'm just going to get this piece away for the top left. There we go, out that comes. There is one more patient in this compilation, guys, so make sure you stay tuned for that one. The next patient is the lovely Mr. Taylor Greens. It's an interesting one because it's a very narrow canal with a super sticky wax, which is never a good combination. It's always a difficult one to do, so make sure you stay tuned for that one coming up right after this video as well, guys. So what we've got now is this layer that I thought was just going to be a tiny bit is now peeling all the way down the canal. So now you can see the itchiness that's going on here. And this is why the patient's been experiencing it. Basically, the itchy response was the body's way of trying to get this patient to scratch that away. But if I take this away now and then the patient starts using some oil, it's going to make a massive difference to that sensation in his ears. Look how that's peeling. It's almost like the whole surface layer of this skin has gone super dry. What people don't realize, you see, when you're using cotton buds is you get yes, you do get a nice sensation in your ears. No one's going to argue against that. It does feel quite nice sometimes. But what you also get is you strip. Did you see the top of eardrum. Go back and take a look a second. If you take a look and you've got the top left corner, I think the patient might have a patulous eustachian tube because you just saw a little bit of a movement. Go back in the video, guys, only a couple of seconds, and keep your eye on the top left corner of the eardrum and you'll see a little bit of this. Patulous eustachian tube, sorry, I've gone off topic again, haven't I? What was I talking about a second ago? Oh yeah, when you're using, I'll come back to that now, I promise. When you're using cotton buds, you strip all the natural oils away. So although it feels nice, you're actually you're causing more problems because you're taking more oil away, which is then going to cause the ear canal to become more dry. Patulous eustachian tube. Patulous eustachian tube. Basically, what that means is eustachian tube is the tube that connects the middle ear space to the back of the throat. It's the one you use when you pop your ears. Now, normally that stays closed until you yawn, swallow, chew, and it opens briefly to equalize pressure. Now, some patients, instead of it being closed, what it does, it just stays slightly open. So when you're breathing, you've got that pressure change of air moving up and down. What that does, it changes the pressure inside the middle ear space, and you start to see the eardrum doing this, flexing in and out with breaths. Go back and take a look at it. It is, I'm sure it's that. It looks really interesting. This is Taylor Green's patient, and this is a really, really thick, sticky wax in a very, very narrow ear canal here. He's gone in with a bit of suction, added a bit of oil. Now I can see that, so he's taking this away. I've got to be honest, with consistencies of wax like this, I would probably, at this point, have gone in with some irrigation just to shift this along a little bit. I find it works really, really well for these stickier, thinner kind of wax types like this. But in fairness to Taylor Green, obviously he's not here. I don't know, there might have been a reason why this patient wasn't suitable for irrigation, which is why he's carrying on with microsuction here. But we're taking this piece away. Always more difficult ones to do. These really sticky, tacky, almost granular. Now, I've had these over the last couple of days worth of videos, and I've voiced over about 3 days worth today. Over the last 3 days worth of videos, there's always been at least one with this kind of granular type of wax. And it is super sticky. And, you know, as much as you try and pull it out, it is almost like jam, if you like. I'm trying not to spell food stuff, so I promise, but it is almost like a jam, a treacle almost, molasses, those kind of, you know, really, something really, really sticky. It's like trying to take that out and it just smears everywhere. So we're just pulling this through. So I can see he's used the oil, and it is helping because it sits on the canal wall. So as you start removing this stickier type of wax, it does tend to slide a little bit better across the canal wall without adhering to it. So we're just going in, let's get rid of this bit. There we go, peeling off that left side of the canal wall really, really well. There we are, it is starting to really come over. Oh, there we go, that's what you wanted. See that little spin? It's just where that last little piece there, and we know is detached. Now this is always going to be awkward, get it through this little narrow canal. It's coming there. It might be too narrow to get a curettage tool through. Sometimes they are, you know, ideal tool for this particular consistency of wax in this area would be Ricurette or Jobson Horn, but sometimes it's just the canal's just a bit too narrow to get that in. Oh, I don't know, he's doing well with the suction here. We got it around the bend. There we go. Out that comes. Let's take a look beyond. That's a lot clearer than I thought it was going to look. I've got to be honest. I thought we were going to get lots of tiny little dots in there, but we're 1.5 centimeters, just over ½ inch. Well, guys, thank you so much for watching the video again today. If you do enjoy the videos, you can always like, heart, share, follow, and subscribe. If you thoroughly enjoy the videos, you can also consider becoming members of the channel. That way, then you get to see even more videos. Like tomorrow's video, I think, is a members video. Yes, it is. Tomorrow's video is a members video as well. But guys, as always, take care of yourselves, take care of your ears, and take care of one another. And I shall see you. Oh, actually, me and Taylor, we'll see you real soon. Bye, everybody.